Assalamu alaikum. Good morning, everybody. Thanks, dear shared persons, and special thanks to the conference board that make my presentation the first presentation in this important conference. And I'm glad to be here presenting this topic in front a group of highly professional professors and physicians in different clinical medical specialties. So, as you know, the title of my presentation is Cardiac Patients at Work, Risk and Protection. So, I would like to start my presentation by a question, if you please. How many of you knows or ask their patient about their job? Okay, so how many of you get more details about the job or occupation of his patient? Very little number. So I'm here to encourage you to get occupational history from your patient, and I'm sure at the end of the presentation you will know why you need to take occupational history from our patient. This is the agenda of my presentation, which I will answer important questions about this topic. The first one, can cardiovascular disease lead to unsafe workplace and medical emergencies in workplace and industry? And can work predispose or lead to cardiovascular disease? How to prevent cardiovascular disease at work? And what are our rules as physicians to protect the cardiac patients at work? At the end of the presentation, I will answer an important question about can artificial intelligence help cardiac patients at work? All of us know that the cardiovascular disease is the first leading cause of death all over the world. Cardiovascular disease killed about 18 million persons in 2019. And also in Egypt, cardiovascular disease is the first leading cause of death. Indeed, the incidence and mortality of cardiovascular disease all over the world decreased, but this decrease stopped and it is returning back to increase. On the other side, the world loses about 2.78 million workers a year because of occupational diseases and accidents. So, as cardiovascular disease prevalence is increasing all over the world, it is also increasing among workers in the work forces and the workplaces. And it represents about 20% of the mortality due to occupational diseases. Let us answer the first question. Can cardiovascular disease lead to unsafe workplace and medical emergencies in industrial area? The answer is, of course. A cardiac or a workers with cardiac disease can have syncopal attack, chest pain, or whatever that lead to coma. So he will be exposed to fall from height. He will not be able to control a machine or a vehicle. They can do their work in a good way like other healthy workers. So mostly they will be hospitalized, and there will be increase in morbidity and mortality, and increase in the absent days and loss of production. On the other side, they don't only harm themselves, but also they can harm others if they are driving like a train or responsible for other lives. And in Egypt, it is reported that about 1,000 train accidents happened in year. When they examined this, they found that some of the drivers had cardiovascular incidents, and this was a cause of loss of their control on the trains, and a devastating accident happened. This slide shows the occupation and jobs that cardiac patient can't work. Like firefighters, military and police personnel, workers working at height, like construction workers, divers, the truck drivers, people working in hot or cold workplaces, people responsible for the lives of others. It seems that, as we know, that we do fit testing and for workers before joining this job. However, at the end, even if they started healthy, they will be at risk to many factors that can lead to cardiovascular disease. So the cardiovascular disease cost our world 3.7 trillions from 2011 to 2015. The next question is, can work predispose or lead to cardiovascular disease? All of us know the modifiable and unmodifiable risk factor of cardiovascular disease. I think environmental factor is one of them, but we need to give more focus and the spotlights on the occupational risk factor. Those are the occupational risk factor present at any workplace that can lead to cardiovascular disease. The first one is personal factors related to the workers. The second is occupational exposure to psychological risk factor, exposure to chemical risk factor, occupational exposure to biological risk factors, and the other work-related factors. Let us discuss the first risk factor, personal risk factor. As you know, elderly workers increased in workplaces, and as you know, they already at risk to develop cardiovascular disease. So they will be more at risk due to exposure to another risk factors. For female workers who usually works in healthcare facilities and teaching, education, service industries, they will be more exposed to risk factor because maybe they will be pregnant, they have family responsibilities more than male workers, and their physiological and hormonal system may be affected more. Also, the immigrant worker who immigrate or migrate to other countries to earn money, they usually will work the hard jobs, they will smoke more, they will eat unhealthy food, and they will be exposed to more risk compared to others. And all of these factors can increase the risk of cardiovascular disease. Let us discuss an important risk factor, which is chemical risk factors. This slide explains briefly the different chemical risk factors that can lead to cardiovascular disease. Sorry, I will not be able to elaborate more, but in short, they are such as carbon monoxide exposure, exposure to welding fumes, solvents, carbon disulfide, lead, exposure to nitrates, exposure to cadmium, to arsen, and the other factors. And for example, exposure to solvents in different industries can increase the cardiac sensitivity to epinephrine, which can lead to arrhythmia and sudden death on exposure to higher level. Carbon monoxide is a well-known agent that will cause about 25 carboxyhemoglobin in the blood, can lead to arrhythmia and sudden death. And the other risk factor, which is a physical risk factor, such as exposure to noise, exposure to hot workplaces or cold workplaces, exposure to electromagnetic field, ionizing radiation, exposure to vibration, segmental or whole body vibration. All of these risk factors can lead to cardiovascular disease. As regard to psychological risk factor, this slide can summarize what I want to say. This is what is happening now in Gaza Strip to the healthcare worker who are doing the work in a catastrophic environment. and sometimes they found their beloved person killed among the patient they try to save. So high demand, shift work, long working hours, stress, work insecurity, and other factors can lead, of course, to burden on the cardiovascular system and lead to cardiovascular disease. On the other side, sedentary work. Even sedentary work, because of developing obesity and the role ambiguity, this can increase the cholesterol level, leading to cardiovascular disease. And also the long working hour, as WHO reported that working more than 55 hours a week can predispose to sudden death due to cardiovascular disease. The heavy lifting or cargo patient who lift large or who doing heavy work, if this happened suddenly, can lead to cardiovascular insult. And I think there are a lot of reports of athletes lifting these heavy weights. They died due to, for example, dissecting aortic aneurysm. Smoking at workplace is a well-known risk factor for cardiovascular disease, and we need to encourage workers to stop smoking. Besides second-hand smoking and even the e-cigarette, there are some reports that it is also can predispose to cardiovascular disease. For the biological hazards, any infection that can affect workers and affect the cardiovascular system is considered a risk factor. And nowadays, COVID infection has a well-known burden on the cardiovascular disease. So how to prevent cardiovascular disease at work? This is a very important question. So we don't want to wait until we have cardiac patient at work. This is through the well-known measures like sports and walking, like healthy foods, like stop and smoking cessation, like having frequent rest and breaks with ample fluids, and also with providing occupational health services. And even the workers should be trained on CPR training, and the AED should be available for any emergencies. So now, what are our physician roles? What are our roles to protect cardiac patients at work? I summarized here in this slide the physician roles to manage cardiac patient at work. So the first one is to provide occupational health services, such as pre-employment examination, periodic examination, examination after return to work. All of these services should be provided to our workers to protect them from developing cardiovascular disease and other diseases. Secondly, to provide medical service by cardiologists. Third is to provide first aid supplies for cardiac emergency. And fourth is to provide consultation on when to return to work if the cardiac patient has any cardiac emergencies. And in this slide, I summarized based on different papers published systematic reviews, when cardiac patient can return to work after cardiac incident. Indeed, this depends on many factors, like the type of cardiac incident, type of management done, the personal characteristic of the worker, occupation and job description of the workers, employer attitude and workplace environment. And still this timing or this information still there is no worldwide consensus, but I can say that it is still a recommendation. So, for example, any worker had angina and myocardial infarction can return to work in about 4 to 6 weeks. For angioplasty, can return to work within 1 week. For CABG, can return to work within 2 to 3 months, and so on. So, we reached the last question. Can artificial intelligence help cardiac patient at work? Indeed, because of the short time of this presentation, I invite you to read my latest article published on PubMed entitled Artificial Intelligence Occupational Health and Safety, Benefits and Drawbacks. At the end of this presentation, I want to emphasize that cardiac patients don't need us only to treat, but they need us also to protect. Thank you very much and hope that this presentation is of benefit.